business. E-this, E-that. Well, now we're talking about e-health. Will I be going to a hospital to get a computer sent to me? Okay, let me just introduce my guest straight out. I have with me to my left, he is Dr. Ahmed Saeed, and he's the Director of Transport and IT of the 53rd Conference of 53rd Annual Delegates Meeting and Scientific Conference of the Nigerian Medical Association. It stands in 2013. Good morning. And to my right, I have another doctor who I hope will be attending to patients and not leaving the patients to the machines, Dr. Peter Nubi, the publicity secretary of this 53rd conference, and he's a member of the Nigerian Medical Association. Good morning. Good morning. And we're talking about e-health, potentials for improving healthcare delivery in Nigeria. What is that all about?
Well, good morning, viewers. Well, the Nigerian Medical Association, we looked at the plight of Nigerians, and we realized that the rate which Nigerian population is growing is more at geometric proportion, and the penetration of doctors is more like arithmetic. And even at that level, people are leaving the shores of this country. So we now have a wide gap in healthcare delivery. People do not have adequate access to healthcare. And then we look at what has been happening and what is being practiced over there. And we realize that one of the ways we can net this practice is through electronic health. We realize that the electronic health is something that is being done everywhere in the developed world. And I will give an example. You buy a drug now, you want to know whether the drug is genuine or not. After the package scratch, and then you send, and instantly you receive a message that this is fake, this is original. That is electronic medium. Making sure that patient gets the best drug. It is possible for a doctor to sit in his consulting room and is able to communicate with other doctor who is having an issue and he needs a second opinion. So with that, you realize that there is inter-sectorial collaboration. Patients are able, in fact, it's possible for you to be in Lagos here and you access healthcare in India, healthcare in any part of the world through this electronic medium. It's also a way we want to reduce paperwork. You go to hospital, you are looking for a file. Maybe you've been in hospital in the last 10 years or 20 years, and then to get the file, something is missing. But with e-health, information, database, everything is stored. And so just at the click of a button, you can have everything there.
Okay, let me ask Dr. Saeed. Dr. Saeed, do you think this is possible in Nigeria? You know we have so many issues. Epileptic power supply, for instance, because, you know, when we were talking about going cashless, that was one of the issues, the POS, the ATMs, how will they run without public power supply? Will this work?
Well, thank you very much. Let me start by saying, I think the question is not whether or not it will work, because it is already working. Start from the drug manufacturers that Peter just gave an example of, anti-malarial, anti-diarrheal. Many of them are already doing this, even at the point of delivery. You know, your chemist out there, your pharmacist out there, once you purchase it, you can do it over it and you get the message on your phone. So it's already happening in our health institutions, even in Lagos. I remember that from years ago, 3-4 years now, the Lagos State government actually commissioned their own version of the e-health program, and they started from patient records. And that's why if you look at the pilot centers, at that time I know because I was in Lagos then, the Kenya up to now, at every point you find, you know, an IT personnel attached to that point. At patient ward, if you go to Kenya, for example, patient at patient clinic, the records, the pay points, you no longer have to handwrite receipts anymore. Now come to the consulting room. In many of our hospitals right now, I am not saying that we're there, but we're saying that it is possible given the progress we have made so far. You mentioned epileptic power supply. if every train in this country depended and still depends on public power supply, these studios will probably not be running. But so the fact of LTVA still running in spite of all the challenges is a good sign that the e-health program, now being further elaborated by the Nigerian Medical Association through this 53rd conference, is a good sign that not only will it work, it will succeed, because we will have come this far despite the challenges. But it means that with a little incentive from all stakeholders, we will do wonderfully well.
Well, do you see it transcending? You were very emphatic about the Lagos State government hospitals now.
Yes.
Do you see it transcending? Do you see it going to, happening in private hospitals as well?
I started with the Lagos State government-owned hospitals because, the general idea is anything owned by government will almost never work. So if you have a government setup
And it's already
doing this, then you can just imagine what already is happening in the private sector. The man there knows that he has invested so much. I know of many private health establishments that are already e-connected. Not only are they e-connected, they are e-managed. They are actually performing e-procedures. In my center, for example, there are procedures we call minimal access procedure, laparoscopic surgery. You can operate a patient without physically putting your hand in the patient, for example, abdomen.
Yes.
And in no time the patient is up. Now the additional benefit of that is while you're operating, because there is a camera attached to every instrument you're using, it's possible for someone outside of the theater suite or even outside the shores of the country to see
what you're
doing as you're doing it. And the import of e-health is that you won't perform, say, a high-risk procedure, right? And then there's someone out there who can be communicating to you. And these are the things that take our people outside the country, and we want to bring them back. If we just have the support that we need. That is what the conference
is all about.
Is trying to bring to fore. The brains are here, just give us what to work with, and you will get the best results.
Okay then. Okay, let me ask Dr. Nubi, when will this conference start, and what are the modalities, the venue?
Well, thank you very much. The conference is starting actually by tomorrow. We expect our guests to start coming in. And then 29th and 30th, we have free medical mission at a suburb part of Lagos. Makoko will be going there, free health, taking care of their major challenges will be addressed, and there will be appropriate referral. And then on Wednesday, we have a cocktail party, in which we expect other delegates to join us on that Wednesday. And then the opening ceremony actually starts on Thursday, 7th, at the Unilag Multipurpose Hall, where we'll be having dignitaries, eminent personalities. Our own Ashiraju Tinubu will be announced. The governor of Lagos State is expected. We expect to see Oba of Lagos, Oba Rilwan Akiolu, and eminent personalities. And then on the 3rd, which is Friday, we have Olikoye. We all know what Olikoye has done to revitalize the health sector, especially the primary health care, which is actually the beginning of solution to the Nigerian health problem. We are doing the rural lecture, which is the third of the series. We thought that, okay, we should give him a befitting lecture every time we have our conference. And then our dinner on Saturday at Lagoon Restaurant. Before I invite you, come around and say that doctors do on wine. Everything is not about good milk and what.
But I don't want to put on those white coats there.
You come around.
Okay, and the World Press Conference?
Yeah, the World Press Conference
Sunday.
on Sunday.
All are the Unilag multi-purpose forum.
Yeah.
Okay, so I expect that doctors from outside the state will be getting the new co-hospitality treatment.
That's how we started from the way we're trying to move them in.
Really?
As I spoke with you, we have information on every single delegate, when they expected to arrive later, how, by what means, At what time? As I spoke to you, we have hotels already booked. In fact, between 60-75% of our delegates already have rooms allocated to them, such that as they are arriving, this story of we got there, we had been waiting at the car park bus stop for 3 hours, we got lost in Lagos. This program has put a lot of things in place to cut that out. So as our delegates are arriving, they're being moved in there.
Okay then. Okay, so let's go talk about e-health, potential for improving healthcare delivery in Nigeria, ECO 2013. Thank you very much, Dr. Said, for being part of the program, and of course, Dr. Nubi. Thank you very much. I don't like Dr. Nubi. Not too much. Not too much. I said not too much. You heard. I said not too much. Thank God they're not putting on white coats. Thank you very much. And please, let's have the best just for Lagos. We'll take a short break now. Big Boy Shola Connect. We'll be back shortly. Please stay with us.